everyone. Thanks for tuning into my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Things are looking good out there, almost everywhere except parts of Asia and New Zealand. There's a slight uptick in England, so we'll keep an eye on that. Last week, we talked about the new CDC community levels, which assign each U.S. county a color, green, yellow, or orange, indicating level of risk and shifting focus to hospitalizations and hospital capacity. And I explained that the country had gone from 95% living in a county where masks are recommended by CDC to less than 40% in the time it took to give one press conference. Well, a week later, on March 3rd, less than 10% of Americans lived in an area where masks are recommended. And by the time this vlog posts, we'll have a new map again, which you can find at the URL on your screen. Think of that as a weather map, indicating the level of COVID-related danger out there. There will never again be zero risk from COVID, but we can make decisions about what we want to do to protect ourselves based on how much COVID is out there, how the hospitals are doing, and our own risk factors and risk tolerance. Up and down the East Coast and in a few other states that have had school mask mandates since 2020, kids are seeing their teachers and friends' smiles for the first time. It's pretty cool. Cheryl from Needham asks, I am a family child care provider for toddlers who are not masked. I am over 60, my husband is almost 70, and I have concerns for our safety even though we're vaccinated and boosted. So I'm remaining in a KN95 mask whenever near the children. I also volunteer at hospitals, but wonder if I may be risking spreading infection between my two jobs, even though I am masked in the hospitals and change and wash everything after work. Is there anything more I should be doing, or less? Cheryl, it sounds like you are doing all the right things. Wearing a KN95 is great protection for you when you're working with the little ones. Make sure you're getting it from a reputable source because they can be counterfeit. And when you wear a hospital-issued mask, that's great protection for the patients you might be interacting with at the hospital. Of course, you should also have a very low threshold to get a test and stay home if you have any symptoms, and call your doctor right away if you or your husband develops COVID. So the big question is, with vaccine and booster and plummeting case counts, is there a time that you could take care of the kids without a mask on? The CDC says that time is now if you want to. Needham is in a green county where the CDC doesn't recommend masks, even for people at high risk. But that is completely up to you. Our second question is from Lucille from Boxborough. It's hard to believe that the Florida Surgeon General is recommending that children not be vaccinated against COVID-19. I'm concerned that this is extremely dangerous and risks both the health of children and prolonging the pandemic. What are your thoughts? Well, I disagree with him. Both the FDA and the CDC have external advisory groups, world-renowned experts who look at every shred of data and decide whether the benefits of these vaccines exceed their risks. And both groups have repeatedly voted in favor of making the vaccine available for children. The only risk that is really of significant concern is that of myocarditis, or inflammation of the heart, which is most common in males and most likely to occur between the ages of about 12 and 29. You can see on the screen the rates of myocarditis by age and sex as assessed by the CDC after dose 1 and dose 2. Given that nearly 1,000 children under the age of 18 have died from COVID, mathematically, that's still a risk worth taking. Where I think there is a gray area is on the question of how many doses a healthy child needs after confirmed COVID infection, and which children actually benefit from a booster. And I hope we will soon have more clarity on those two issues. Our last question is from Arnie from Oxford. It was great to see that Boston hospitals are working together to study long COVID, which I think has been one of the most overlooked aspects of the pandemic. Have there been any recent developments on understanding long COVID, who is likely to get it, and how to treat it? Arnie, the multi-center study on long COVID that is being launched is so important. We still have more questions than answers about long COVID. What is it? Of the 200 different symptoms that have been attributed to long COVID, which ones are actually associated with COVID and which are unrelated? Of the ones that are related, what are the various mechanisms involved, which are likely to be very different if you're talking about, say, loss of smell versus brain fog? And why do some people get long COVID and some not, and so on? There have been a number of studies recently giving us small bits of information that are slowly coming together into a bigger picture. One showed brain changes after COVID. Another showed small fiber neuropathy, a condition affecting nerve fibers in the skin. One particularly exciting study found that 4 factors were associated with a higher likelihood of developing prolonged symptoms after COVID. The level of coronavirus RNA in the blood, the presence of autoantibodies like the type seen in autoimmune disease, having type 2 diabetes, and reactivation of Epstein-Barr virus, which is the virus that causes mono and then stays dormant in your body forever. The good news is that some of these factors are theoretically modifiable with treatment, so it definitely gives us a starting point, but there's a lot of work yet to do. That's all the time we have for this week. You can send me your questions about the rollback of mask mandates and other COVID restrictions, our new normal, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.